Moderating this session today, along with Lori Moriarty. So if you need any technical assistance, we are here to help you. Seek us out in the chat if you need anything. We're going to hear some great information about drug trends and prevention efforts right there in Douglas County in just a moment. And Krista will come on and introduce our speakers here in just a second. But just so you know, if you didn't hear, this session is being recorded and it will be up for your viewing pleasure, sent out to you by October 22nd. So during the session today, we do ask that you keep yourself muted unless our speakers ask you to unmute and participate and speak. That way, with all of that background noise, we keep it in the background. We do want to hear from you though, so make sure that you're participating in the chat. You can let our speakers know that you're here and where you're from, so go ahead and start that chat going and make sure you're engaging in the chat with us today. Also watch the chat because there'll be information coming to you about continuing education credits. Those are going to come in the chat today, so make sure you watch for that information. So let's get started. Let's jump right in. Krista Machado, she's going to come on and introduce our speakers today.
Great, thank you, Crystal. Yes, as Crystal said, I'm Krista Machado. I work at DECA as well, and I'm a prevention program coordinator. And we also have Kail Winfrey-Gorzek, who's a prevention specialist here at DECA, and Lydia Fuqua, who's our lead prevention specialist here at DECA as well, that will be presenting today. Next slide, Lydia. I'm going to just start us off with some basic data trends, kind of state level, and a little bit about Douglas County before we get into the more hands-on Douglas County related information with Lydia and Kail. So this graph that you're looking at here is showing our overdose death drug trends here in Kansas. And as you can see, in 2020, we had the highest ever recorded number of drug overdose deaths at 477 deaths for the year, which is pretty significant compared to 2019 and any previous year. It's pretty high of a jump, and it seems like 2021 it's just going to continue to increase. And so it's a big concern with our drug trends on the rise in the state. And what you can see with those little lines off to the right there, that we had 254 of those 477 were due to an opioid of some sort. So it might be synthetic or illicit or prescription opioids. And then 183 were stimulants. And so I put those on the chart where they would fall if you combine them together, as those are the primary drivers of this crisis that we have in Kansas associated with overdose deaths. With this age group, or with these trends, the highest age group of these overdose deaths were among those 25 to 34-year-olds, and followed by the 45 to 50-year-old population. We also, in this year, it wasn't the highest age group, but we saw a very large increase in overdoses among 15 to 24-year-olds as well, which is really concerning that the overdose deaths are getting younger and younger. And that was actually more than double the rate from 2019 for that population. So that was a big jump. The majority of these overdoses are male, about 64% of them. And then in Douglas County, from 2011 to 2020, we experienced 130 overdose deaths just here in our county. 62% of those were due to an opioid and 22% were due to a stimulant. And so they're still consistently the highest drugs of concern in Douglas County as well, like the state. Next slide, please. This is just a map showing these overdose deaths for the state by county. And so I highlighted Douglas County there. We had, sorry, these are actually not deaths. I titled it wrong. These are actually emergency department visits. Sorry about this. Non-fatal overdoses. I titled that incorrectly. That was my bad. And Douglas County had the third highest rate of those non-fatal overdose deaths in 2020 at 11.54%. And then it's consistent in 2021. They have data out through May of 2021, and our rate is the fourth highest in 2021 at 13.10, so it went up. This also has that age group of 15 to 24-year-old population that has highest risk. They actually have the highest rate of non-fatal overdoses. While they weren't the highest in fatal overdoses, but they had the highest rate for those non-fatal overdose emergency department visits, those 15 to 24-year-olds. And then I didn't put a graph here, but just wanted to mention that we're doing pretty well in Douglas County, and our opioid prescribing rate has continually decreased each year since 2016. So props to all of our healthcare providers and our prescribers in our county for helping us combat the opioid crisis in our county. With that, next slide, please. This is data from our 2021 Kansas Communities That Care student survey. So we surveyed 6th, 8th, 10th, and 12th graders every year with this data. It's a statewide survey. I'm sure many of you know about it, but this is just Douglas County specific data. So in 2021, we had 10.8% of our youth saying that they have consumed alcohol in the past 30 days. And that's compared to the state rate of 10.89. So we're slightly lower than the state rate there. Douglas County youth reported marijuana use in the past 30 days. That was 6.27%, and that is actually higher than the state average, which was only 4.12%. 18.3% of our youth here in Douglas County report ever having tried vaping. It's slightly lower, which is great, than the state average of 19.02. And then 39.39% of our youth say that they've experienced sadness or hopelessness for almost every day for the past, or for 2+ weeks in a row. And that rate is actually higher than the Kansas average, which is 37.98. So about 2 percentage points higher than the state average. With this, I'm going to turn it over to Kail and Lydia for the more interesting and Douglas County specific information and initiatives. So Kail, take it away.
Thank you, Krista, for setting that up. So we're just going to take a quick second to talk about fentanyl. We see fentanyl as an emerging topic. I think what's important to mention here is that fentanyl has always been around, but it's emerging now more than ever. And so let's just take a second to talk about what it is. According to the CDC, fentanyl is a synthetic opioid used to treat severe pain and was actually 50 to 100 times more potent than morphine. And unfortunately, most recent cases of fentanyl-related harm, overdoses, and death in the US is linked to illegally made fentanyl that's sold through illegal drug markets. As we've seen, fentanyl is usually mixed with heroin and or cocaine as a combination product, usually without the user's knowledge, to increase euphoric effects. So, and as we see on the screen here, and as Krista mentioned, with the increase in deaths that we had in Lawrence, we've seen predominantly in the US and here in Lawrence, the reason why we have the increase in heroin usage is that it is linked to fentanyl, which has led to an increase in the number of fatal overdoses here in our own community. Fentanyl is typically added to heroin at some point along its travels to increase the potency, but adding the fentanyl is not precise, and the effects on users, can be extremely unpredictable. So we actually lost 93,000 people from these types of overdoses last year, which is a 30% increase. So far this year, the DA has seized more than 9.6 million deadly counterfeit pills, which is more than the previous 2 years combined. And we put that in perspective, 2 out of the 5 pills coming into the country are laced with fatal doses of fentanyl, which actually now led to the DEA releasing its first public safety alert in 6 years. An agent with the Drug Enforcement Administration offered this perspective, and you can kind of see this depiction on the screen there, is that about 3 to 5 grams of table salt, that's the potential fatal dose for an adult, even less for a youth. Locally, we actually lost 16-year-old Cooper Davis of Shawnee to a fentanyl overdose on August 29th. It was him and a couple of friends. I believe that he was the only person that passed away after taking one of those counterfeit pills. And his mom recently just released a statement that she is finding strength and healing and sharing his story, right? Because she said that we need something good to happen. They want to use Cooper's story to save lives because it is an education of substance misuse, what's in those substances, and increasing harm reduction efforts that will help fight this epidemic. Which then brings us into our next slide, where we discuss some specific data relating to youth substance use and mental health. So in December 2020, Engage Douglas County conducted a survey of youth and parents regarding youth substance misuse and mental health in Douglas County. We received about 446 youth responses and over 1,000 parent responses. Youth reported in the survey that relationships are the biggest that impact teens' mental health, including peer pressure, fitting in, being left out, drama amongst peers, and also bullying. School can be a major stressor. We know that home life, substance use, mental health conditions such as depression, anxiety, stress, social media, those are also things that are reported by youth that impacts their mental health. Regarding substance use specifically, youth reported that their peers use substances in a variety of locations, and this can happen at home, at a friend's house, and the school bathrooms is a big one that we've seen increase, behind buildings, parks, cars, countries, out in the country, and in parties. Youth shared that often substance use takes place at night and away from people, but some youth do use substances in their own homes because parents allow it. It is reported that the use of substances typically occur after school, in the evening, at a home. Oh, sorry, I just repeated that part. But I think what's important to mention there is that even though it's happening in those locations, it is happening together as a group or also alone as well. Using what we have learned from this survey and what has inspired the Engage Douglas County Fall campaign, which you'll hear more about in just a second, is that 82% of youth reported that their family has clear rules about alcohol and drug use, compared to only 65% of parents believe that families have clear rules about alcohol and other drugs. So with that, Lydia will now actually go ahead and take us and tell us more about Engage Douglas County.
All right. Thank you, Kail. So Krista, Kail, and I are members of Engage Douglas County, and that's sort of the lens we're taking you through this afternoon in terms of the prevention efforts happening in the county. Certainly there are far more beyond what Engage Douglas County is doing, but since that's the avenue that we're coming from, that's kind of where our focus is going to be for the rest of our time together. So just a little bit of background about Engage Douglas County for those of you who aren't familiar with the coalition. It was formed in January of 2019 in response to the Douglas County, Kansas Community Health Plan, which was facilitated by the Lawrence Douglas County Public Health Department, or Lawrence Douglas County Public Health. The plan actually identified a variety of data points indicating that substance use was an issue in the community. The plan really placed an emphasis on behavioral health and focused on moving from crisis as a norm to prevention and recovery as a practice. So within the plan, prioritizing prevention really emerged as a top issue. And with that, community partners were convened to begin assessing prevention needs in the county and then building the capacity to address those identified challenges. The coalition utilized the strategic prevention framework process to develop a strong prevention plan with diverse community partners. And we continue to seek new partnerships within the community and grow our youth prevention efforts. You'll hear us say a million times today, join Engage Douglas County. We welcome everyone. The more the merrier with this effort, because it is only in our collaboration and within the community that we're able to make these efforts successful. So as far as what the coalition works on, we help increase awareness of issues that affect many of our residents. So these are things like suicide, alcohol use, vaping, drug use, as well as other issues that might come up in the community. And really through an increased awareness of these issues, we're hoping to enable the residents of Douglas County to seek support when they need it. So breaking down that stigma and encouraging help-seeking behaviors. We also focus on prevention efforts from a variety of resources and organizations in the county. So we sort of act as a center link, connecting these pieces to make it easier for members of Douglas County, residents of Douglas County, to better utilize those resources and increase community awareness of those resources. So through our partners, we work to provide support for issues that affect the residents who live in our county. And we're going to talk specifically about what those types of supports are, or at least a few of them. Later on during our time together, we'll post the Engage Douglas County website in the chat, so you can access that information and learn more about the coalition. But we also wanted to share that Engage Douglas County was recently awarded a 5-year, $125,000 drug-free communities grant. And that is funding to address alcohol and marijuana use and build youth prevention efforts in the county. So we'll spend a lot of this presentation discussing those prevention efforts related to drug-free communities, or DFC. But again, it's important to note that we're focusing just on Engage Douglas County and specifically on youth alcohol and marijuana misuse prevention. Again, that doesn't mean other prevention efforts aren't happening in the county. They most certainly are, but today we're focusing specifically on Engage Douglas County's efforts. We did want to highlight our list of Engage Douglas County partners. This actually probably needs to be updated. There are several partners missing who are at the table, but this gives you a sense of those who are part of the coalition and its efforts. We would love to see your name up here as well. So again, just inviting you to join us at the table, but we do have great representation from different agencies and organizations in the county. So we're going to walk you through a couple of prevention efforts that we'd like to highlight that Engage Douglas County is working on. The first one being sources of strength. And I won't spend a ton of time on this one because if you were here with us on Tuesday, our session was entirely devoted to sources of strength. So this will just be a quick overview. But this is a radically upstream suicide prevention program. And the model is pretty simple. It can be facilitated in schools or youth-serving organizations. But really what it does is it brings supportive adults together, empowering a diverse group of young people, of peer leaders, and they use messaging campaigns to promote a positive culture change within the school or the organization that they're a part of. So it is a suicide prevention program, but it's life-giving, it's fun. It asks the questions, what are the leading causes of life? It's a really special program. It's designed to build protective factors and reduce the likelihood that vulnerable youth will become suicidal and also engage in other risky behaviors. One of the cool things is students who are trained in sources of strength are 4 times more likely to refer a peer to a safe adult. We know that teens like to talk to other teens when they're experiencing issues. So this is a pretty powerful data point that they're more likely to connect with an adult after participating in sources of strength. The program promotes 8 critical protective factors that are linked to overall wellness and reduce risk of suicide and other risky behaviors. So you can see the strengths wheel on the screen. So family support, positive friends, mentors, healthy activities, generosity, spirituality, physical health, and mental health are the focus of the program. And the activities are really aiming to reduce the acceptability of suicide and other risky behaviors as a response to distress and increase the acceptability of seeking help. The goal is really to improve communication between youth and adults and help young people develop healthy coping attitudes. So how the program works is it trains students as peer leaders and connects them with adult advisors at the school and in the community. And those advisors support the peer leaders in carrying out these messaging activities that really aim to change peer group norms. And they do this by influencing coping practices, like I mentioned, and also problem behaviors. So it's really designed to modify the knowledge and attitudes and behaviors of the peer leaders themselves, and also the student population at large as well. So sources of strength is currently being implemented at Eudora High School. They're in year 2 implementation, as well as Lawrence High School and Free State High School. They're in their first year of implementation. And Perry LeCompton Middle School, Baldwin Middle School, Baldwin High School, and Billy Mills Middle School are also in the process of getting onboarded to implement sources of strength. So this is a great program that not only builds resiliency and coping skills to help prevent against suicide, but also against other risky behaviors such as drug use. So really, really great program there with lots of good momentum. The next project that we wanted to highlight is the Safe medication disposal program. This is a partnership between Engage Douglas County and local pharmacies. And really it's designed to provide our community with safer options for medication disposal, as well as information regarding prescription overdoses. It's really important to understand why this program exists. You heard a lot about why this program exists a little bit earlier when Kail and Krista went through the data, but prescription drug overdose death rates have quadrupled for youth between the ages of 12 and 25 in Kansas over the past 12 years. So it's really important for us as Douglas County residents to do our part to prevent those accidental poisoning. So we spend a lot of time talking about safe use, only taking medications prescribed to us, reading the labels carefully and following all those directions, safe storage, keeping our medicines in a secure location, monitoring them and not sharing them ever, and then safe disposal, getting rid of all those unused or expired medications by taking them to a drop box, a take back event, or using medication disposal products. And that's where these pharmacies come into play. Currently, we have 6 pharmacies involved in this partnership. So we have Jayhawk Pharmacy on Clinton Parkway in Lawrence, Jayhawk Pharmacy, their new location at LMH West in Lawrence, LMH Health in Lawrence, Auburn Pharmacy in both Eudora and Baldwin City, and Watkins Health Services on the KU campus. So they each have a MedSafe collection unit that is available for folks to come in and drop unused or unwanted medications into. They also provide medication disposal bags to their customers, and they participate in the DEA take back events as well. So really great partnership with our pharmacies there, making sure that the residents of Douglas County have access to safe medication disposal. All right, Kail, I'll turn it over to you for a couple slides.
Yes, thank you. Okay, so we're just going to go through a couple of more programs housed within Engage Douglas County. This is our PACS Good Behavior game, or also known as PACS GBG. It's an environmental strategy used in the classroom, or you can also use it at home. It just helps to create a nurturing environment that's conducive to learning, right? So this intervention is designed to reduce off-task behavior, increase attentiveness, decrease aggressive and disruptive behavior, as well as helps to shy away from withdrawn behavior as well. PACS GBG is also known to improve academic success and improve mental health and substance abuse outcomes later in life. We know that because the PACS GBG is aligned with SAMHSA's 6 principles of trauma-informed care approach to meet the needs of children who have experienced adverse childhood experiences, or other known as ACEs, or other trauma. It's also easily adapted to build success for children with special needs, or used to for positive behavioral interventions and supports, or also PBIS, all the fun acronyms. The PACS Good Behavior game is currently being implemented in Douglas County in grades pre-K through, I think it's 2nd grade, at Baldwin Primary Center, which is actually where the program originated by a teacher in 1967. So there has tons of fun tips in there, just simple things like using a harmonica instead of yelling, or instead of flipping off the lights, and just really trying to implement trauma-informed practices in learning environments is crucial. Next, we have Reward a Reminder, which is a program out in the community. It's an effective research-based prevention strategy with the goal of reducing and preventing the retail sale of tobacco products, vaping products, and alcohol to those under the legal age to purchase. This strategy helps to assess and support retailer compliance. And so with that, you'll see checking IDs to ensure age requirements are being met, and if the purchaser is allowing the selling to tobacco, vaping products, alcohol products to youth underage. So this kind of takes place when you'll see youth will visit the retailer and attempt to purchase, and if the retailer is in compliance, they receive a reward card that praises them and it recognizes them for the initiative to help prevent access to youth. The reward card is also something that employees can use to share with their managers and highlight the good work. If the retailer does not follow compliance protocol, they are provided a reminder card reminding them to verify age before selling. And so to be compliant, retailers do need to display a T21 signage in a clearly visible location, and also make sure that they use a government issued ID or driver's license to verify customer age. So we have those Engage Douglas County stickers that were sent out a few months ago. That should be on most windows and retailers and things like that. So that's been cool to see. And then our next program we will go through is Handle with Care. So this is actually another program that we have that we're working to implement in the schools. Correct me if I'm wrong, Lydia, I believe that Baldwin City is the current partnership that we have right now that has really led this program. So Handle with Care is a collaboration between law enforcement and schools to better support children exposed to trauma at the scene of a crime, violence, or if they're experiencing abuse in the home. The child's name, age, and school are sent by law enforcement in a confidential notice to the child's school before the start of the day. There's no information given except the child's name and words, "Hey, just handle with care." This note will provide advance notice to the teacher as well that a child may be a bit out of sorts and may need some additional support, and allow the teacher to connect to the child on a different level or have the counselor connect to that child as well. This could allow extra time to complete an assignment or just maybe some more practices in place to make sure that the student feels safe that day. The program is crucial as trauma is underreported, underdiagnosed, and it's often misrepresented as being assigned by symptoms of disorders such as depression, bipolar, ADHD, or just general non-compliance, right? I think sometimes we know what it's like to get frustrated when you have a student in your classroom that has their head down, but Handle with Care really helps to break that down farther and see what's going on underneath that and what's going on at home. So the Handle with Care program helps create a trauma-sensitive school that becomes a respectful and safe environment where youth can build positive relationships with adults and encourages them to manage their emotions and behavioral responses, which then in turn will lead to academic and social success. So, Lydia.
Wonderful, thank you, Kail. And actually our first Douglas County Behavioral Health Prevention Summit session was put on by, I believe, Officer Bulmer from the Baldwin City PD, who talked specifically about Handle with Care. So if you're interested in learning more about that strategy, we definitely encourage you to check out that session. It was a really great session, and he provided wonderful insight on how the program works within Baldwin City. The next program we wanted to share with you a little bit about is Douglas County Youth Prevention. I have a quick video that I'd like to share with you, and then we'll talk you through the specifics of the program.
I'm a part of DCYP because of its amazing leadership group that helps spread awareness around our county, things such as mental health awareness, alcohol, and even drugs, mainly to teens and then sometimes even to parents who are just informing them on what their teens are doing today.
I joined because prevention work is something that I'm interested in, and I really enjoy making a difference in my community and in my school.
I love being in DCYPB because it gives me the chance to talk with my peers and make changes.
DCYPB to me is a place where my friends and my peers and I can get together to try and make a change on something that we're all passionate about, something that we care about, and change that we look forward to seeing in the future in our community and eventually in the world.
Hi, I joined DCYPB because it gave teenagers a voice, and that's exactly what I wanted for my community, to talk about and solve problems that were actually happening to teenagers all over the place, and that's exactly what DCYPB gave to me and all of our members. It's such a safe place for everyone, and it's just a great place for us to speak out about the change that we want to make.
Being involved with DCYPB has been a great way to strengthen my leadership skills as well as make a difference in my community.
I always love showing that video because they express what DCYP is and what it means to them better than I ever could. So I always like to start off an explanation about the program with that video. You'll notice that in the video, they called it DCYPB, which it was called until this year. And we'll get into why that is here in just a minute. But first, I'll provide a little bit of information about what it is. So it's a youth-led organization. And the goal is really to create positive change within schools and communities. We provide opportunities for youth to learn more about leadership development, substance misuse, mental health promotion, suicide prevention. So the youth get trained in substance misuse prevention, mental health, suicide prevention, and leadership topics. And then they develop and implement special projects to promote healthy lifestyles. They also get to connect with like-minded youth from other high schools in the county, which is kind of a unique opportunity. They've completed a ton of projects. We started in January of 2020 and then went virtual in March of 2020, and you all know why. So we're just getting back to in-person, but they've been really creative and adapted their efforts for virtual and hybrid settings, and they're really excited to get back in person. Some of the projects they've completed, just to give you some examples, they facilitated a tobacco trash pickup project at South Park in Lawrence and CPA Park in Eudora. So they picked up cigarettes, cigarette butts, and other tobacco trash, and marked each item that they picked up with a red flag. And then they posted yard signs with information and statistics related to the importance of preventing underage tobacco use. They also completed a suicide safety plan, which was a pretty special project. Last year, they hosted a 30-day mental wellness challenge on social media during the month of December to help promote healthy behaviors during a time that can be tough for a lot of folks during the holidays. They also hosted the DCYPB Beats the Virus COVID-19 scavenger hunt, which was virtual. It allowed young people in Douglas County to learn more about the facts related to COVID-19, keeping themselves safe, keeping others safe. And then if you completed the digital scavenger hunt, you got a free mask. They also hosted a campaign called It's Okay to Not Be Okay, to break down the stigma associated with help-seeking behaviors. They've participated in Kansas Takedown Tobacco Day at the Capitol, advocating for tobacco prevention policies with lawmakers at the state level. They've done that both virtually and in person, and have done a wonderful job at that. They've also met with Lawrence commissioners to discuss youth tobacco use and advocate for prevention policies. This past summer, they attended the Community Anti-Drug Coalitions of America, or CADCA, mid-year conference, as well as the Montana Institute Summer Youth Academy. So lots and lots of good stuff that they're up to. And one of the coolest parts about DCYP is we've actually expanded. So that's where the B dropped off. We're no longer the Douglas County Youth Prevention Board. We're just DCYP because we've expanded into chapters at schools and youth organizations. So currently we have chapters at Eudora High School, Eudora Middle School, Perry LeCompton High School, Lawrence High School, Free State High School, and Lawrence College and Career Academy. So this is our first year expanding into the schools. And that was really based on feedback from the youth who were participating in the county board. They wanted to make a more impactful, or a deeper impact, I'll say it that way. They wanted to make a deeper impact with their prevention efforts, and they were really struggling to do that at the county level. They wanted that ability to do it locally within their school or their organization. And so based on that feedback, we were able to expand to these chapters. Each chapter gets a stipend to conduct activities, and then we have county meetings so we can all check in on what one another is doing. And we have a couple of countywide projects each year as well. So great momentum there, lots of cool things going on. Each of the chapters have already started conducting projects. Lawrence College and Career Academy is in the process of planning a mental health panel for sometime in October for students in the community. A lot of the chapters participated in the KSPHQ Let's Chalk About It suicide prevention campaign in September. So lots of really great stuff happening in each of the chapters and at the county level related to both mental health and substance misuse prevention. We also wanted to highlight a couple of really successful strategies that we've been able to implement over the past couple of years. So one of them was related to a project we conducted with alcohol retailers. The Douglas County Youth Prevention Team conducted this in April of 2021. And they provided mints and information cards to 15 Douglas County alcohol retailers, helping thank the community for their commitment to not providing alcohol to minors. They also hosted a social media campaign to go along with that. You can see that picture in the top right is one of the images related to that campaign. It was called Be in the Majority. And with that, they distributed 2,000 Be in the Majority bracelets to Douglas County high schools and libraries to get other youth involved as well with that campaign. So super, super cool. And it was a really great partnership with many alcohol retailers in the county. They were excited to participate and promote that understanding that it's not healthy to provide alcohol to those who are underage. So that was really cool. Another project, Kail mentioned it briefly earlier, but we've been working with tobacco retailers in the county. We've provided them with window clings, counter mats, and penny holders. To help remind customers that if you're under 21, you can't purchase tobacco products. So that's been a great project. Again, lots of enthusiasm from the tobacco retailers to partner on that. You can see the image in the bottom right is what you might see if you go into a tobacco retailer. We card because we care, pretty familiar slogan. Another project that we wanted to highlight is this one on the left side. It's a safe medication project with the Lawrence Board of Realtors. So we provided them with 100 safe medication packets, which included a brochure on safe medication use, storage, and disposal, a medication disposal pouch as a sample for them, and a laminated poster that they can display during open houses and showings to indicate that the home's medications are secured. So just another way that we're trying to promote medication safety in the community, and they've been a great partner with that. And then the last project that we wanted to highlight was the Summer Wellness Series. Some of you may have seen that. It was a social media webinar series. We collaborated with community partners to create 10 videos related to substance misuse, suicide prevention, and overall wellness. The target audience was parents and community members, and we released those videos over the summer from June to August. The topics included responding to a suspected opioid overdose, alcohol and teens, so some safety related to alcohol there, best practices for medications in your home, personal safety, online safety, having a conversation about suicide, firearm safety in the home, support for youth during the summer, safety planning, and then our DCYP teams actually wrapped up the series with a video about supporting peers as they all venture back into schools for the fall. For the first time in a while since the pandemic. So to date, we've had almost 16,000 views on 10 of those, on combined views, I should say, on those 10 videos. So those are still available both on our website and on our social media as well. So we encourage you to check those out. We also wanted you all to get in on the mix. So we've launched this campaign as sort of a back to school campaign. It's a positive social norm campaign. It's called It's Never Too Late. And we're really trying to highlight that over 80% of Douglas County youth say their family has clear rules about drugs and alcohol, which is pretty spectacular. That's a great number. And it's really to help spread awareness of the importance of families having healthy conversations as a protective factor against both substance misuse and suicide, as well as mental health issues. So with this campaign, we're running a social media campaign. I think there are 6 posts. You may have seen those. They're tagged It's Never Too Late, so you can see that on our social media. We also have a physical media campaign with materials that we're distributing to the community. And so if you're interested in receiving some of those materials, we have fridge magnets, giant car magnets, which could be a hit, I don't know. We have yard signs, and there was some, oh, window clings as well. So we're giving those out for free just to help, again, spread that awareness of the importance of families having these conversations. We also sent 4,300 letters to parents in Douglas County, sharing some tips and tricks for how to have healthy conversations about alcohol. And each of those letters contained 10 security strips for families to be able to secure their alcohol at home. So that's just something that we've been working on recently. I'll drop the link in the chat for where you can request those materials, as well as a link for you to learn more about that campaign. All right, Kail, I'll kick it back to you.
Thank you. Yeah, so just again, based off of what Lydia said, the ways that we want to include you in all of our efforts. And a big way to do that is to join Engage Douglas County. I know that's what we plugged at the very beginning as well too. We'll keep plugging that. Engage Douglas County was formed in January 2019. Just some more background is if we learned today, it's from the response to Douglas County Health Plan, and just to identify a variety of data that points to indicate substance use was an issue in the community. Specifically, if anyone has interest, there is subgroups of Engage Douglas County, such as the marijuana work group. I don't know if that's its official title, but that's what I've called it. They'll talk a little bit more about the regulating, some data points and the decriminalization and what that looks like here in Douglas County. So just a good group to be involved in if that's a topic that interests you. And then of course, Engage Douglas County meets as a whole as well. And then under Engage Douglas County, what's recently has been formed is a resiliency task force. So and a few members on the call today may be familiar with that, but the Resiliency Coalition has now combined with the Child Abuse Prevention Task Force. Just we learned there's a lot of duplicative work happening, and we learned that we can do more great work when we all partner together. And so it kind of brought about this big, large organization that we now have that will still work on child abuse prevention, but it will expand to foster resiliency within the community, the families of Douglas County, increase trauma-informed practices, and also working to implement some drug and endangered children work as well. So those are the two big organizations that we're going to promote here today. And then next, we have listed some of the meetings. So you'll see Engage Douglas County, our next meeting is on October 25th from 2:30 to 4. If you would like more information on that, please let us know, and we are more than happy to send you the invite for that. Thursday, October 21st and Friday, October 22nd will be our Kansas Prevention Conference. November 5th from 10 a.m. to 12 p.m. Is going to be our first meeting, is the Resiliency Task Force as a whole. So it'll be our first big meeting, is the combined Resiliency Coalition and the Child Abuse Prevention Task Force, which will be exciting. Tuesday, November 9th from 7-8, we have the Examining Douglas County Protective Factors in Family and School webinar. Wednesday, November 10th is the Kansas Opioid and Stimulant Conference, which I'm super excited about. And then Monday, December 13th from 2:30 to 4, we have our next Engage Douglas County meeting. So there's just a couple of the upcoming opportunities that we have for you all to get involved and learn more about what we're doing here in Douglas County. With that, I believe that wraps us up, and we're going to take some time for questions. If y'all have any questions about Engage Douglas County, any of the information that was shared today, or anything else that you would like to share, please feel free.
And feel free to unmute. I know Crystal told us at the beginning to stay on mute, but if you have questions, feel free to go ahead and come off mute or put it in the chat, either way.
While we're waiting for folks to scan their brains and come up with any potential questions they might have, I did want to point out that our Engage Douglas County meetings are currently virtual, and a lot of the opportunities that Kail mentioned are virtual as well. In fact, maybe all of them. So that is a little bit of an easier way to get involved if you're in a time crunch or super involved, as I know many many of us on this call are looking through the list. Time can sometimes be an issue. So there is a virtual option for lots of these things. So great way to stay connected.
Thank you, Lydia, for plugging that. That's a big point I should have mentioned, so my apologies. Doesn't look like we have any questions as of right now. It looks like Lydia put a whole bunch of resources and links in the chat, which is great. Just some places to register for the conferences are mentioned in some of the opportunities coming up. But if there aren't any further questions or comments, thank you all for joining us today. We really appreciate having the opportunity to share this information with you, and let us know if you need anything else.